Most people think their nails are just there to look nice. Maybe you paint them, trim them, maybe you barely notice them at all. But what if I told you that the appearance of your fingernails, right now, today, could be one of the most accurate windows into what's happening deep inside your body? Not in some vague alternative medicine way. I mean in a clinically documented, peer-reviewed medical science way that neurologists, cardiologists, and internists use every single day. I'm Dr. Arthur Clark, and after more than 20 years of practicing neurology and seeing thousands of patients over the age of 60, I can tell you something that most doctors never take the time to say out loud. Your nails can warn you about serious disease weeks or even months before any other symptom appears. If you caught my previous video on the shocking benefits of adding that powder to your coffee, you already know I don't waste your time. And today is no different. In fact, a landmark study published in 2019 by researchers at the University of Edinburgh found that specific nail abnormalities were present in over 68% of patients later diagnosed with systemic diseases, conditions affecting the heart, kidneys, lungs, and nervous system. 68%. That means more than 2 out of 3 people were carrying visible warning signs they had no idea about. Before we go any further, I want to hear from you. Drop your age in the comments right now and tell me, have you ever noticed any unusual changes in your nails? A ridge, a color shift, a curve, unusual thickness? You might be surprised how many people in this community share your exact experience. Today, I'm going to walk you through the 4 most critical nail warning signs that people over 60 absolutely must know about, ranked from important all the way to potentially life-saving. And I promise you, by the time we reach number 1, you will never look at your hands the same way again. Do not skip ahead, because the condition linked to number 1 is the one most people dismiss as just getting older. And that assumption has cost far too many people far too much. Let's get into it. Let's begin with number 4, and already we're starting somewhere that surprises most people. Take a close look at your fingernails right now. Hold your hand flat. Do your nails curve upward at the edges, like a tiny spoon? If they do, you may be looking at something called koilonychia. And in adults over 60, this shape is one of the most reliable early indicators of iron-deficiency anemia, a condition that quietly robs your body of the oxygen it needs to function. Here's the biology in plain terms. Your red blood cells carry oxygen throughout your body using a protein called hemoglobin, and hemoglobin needs iron to work. When your iron levels fall too low, your body starts rationing resources. It pulls iron away from non-essential tissue, and your nails, which are made of a protein called keratin, become one of the first casualties. Without adequate iron, the nail plate loses structural integrity. It softens, flattens, and eventually begins to curve upward at the sides, producing that characteristic spoon shape. This matters enormously after 60, because the body's ability to absorb iron from food decreases significantly with age. A 2017 study from Johns Hopkins University, published in the Journal of Nutrition, found that adults over 65 absorb up to 40% less dietary iron than younger adults, even when consuming identical amounts. That's not a minor difference. That's nearly half your absorption capacity gone, simply because of age-related changes in stomach acid and gut function. A 2021 review from Harvard Medical School, published in the American Journal of Hematology, confirmed that iron-deficiency anemia affects approximately 1 in 5 adults over the age of 65 in the United States, and that over 60% of those cases go undiagnosed for more than a year because the symptoms are mistaken for normal aging. Fatigue, shortness of breath, feeling cold, brain fog. Sound familiar? These symptoms get written off every single day. Consider the case of Margaret, a 67-year-old retired schoolteacher from Ohio. Margaret came to her physician complaining of persistent fatigue and what she described as thinking through mud. Her doctor almost attributed it to age. But Margaret's daughter had noticed her nails curving. She'd read about koilonychia online and insisted on blood work. Her ferritin level, which measures stored iron, came back at just 6 nanograms per milliliter. The normal range is 20 to 200. After 4 months of targeted iron supplementation and dietary changes, Margaret's energy returned. her cognitive clarity improved significantly, and her nail shape normalized. Her physician later told her that catching it when they did prevented what could have progressed to a cardiac complication. The practical step you can take today, at zero cost, is simply to look. Wash your hands, dry them, hold them flat under good lighting, and look at the curve of each nail. Then, if you're concerned, ask your doctor for a complete blood count and a ferritin test. Not just hemoglobin, because ferritin drops first, and it's more sensitive. Dietary changes matter too. Pair iron-rich foods like spinach and lentils with vitamin C, because ascorbic acid, that's just vitamin C in scientific language, increases iron absorption by up to 67%, according to research from the Karolinska Institute published in 2018. Here's your synergy tip. The next warning sign we're going to discuss directly amplifies the effect of iron deficiency in your cardiovascular system. So understanding number 4 and number 3 together gives you a much clearer picture of your heart health. And speaking of your heart, what I'm about to show you in number 3 is something cardiologists call a silent alarm. And most people over 60 are walking around with it and don't even know. Number 3. And we are moving into territory that your doctor may have never pointed out to you directly. Look at your nails again, this time focusing on color. A healthy nail has a pale pinkish base and a narrow white crescent at the very tip. But if most of your nail, roughly 80% or more of the nail plate, appears white or pale, with only a thin strip of normal pink or reddish brown at the very edge near the tip, you may be looking at what medicine calls Terry's nails. And in adults over 60, Terry's nails are one of the most well-established visual markers of liver disease, congestive heart failure, or type 2 diabetes. The mechanism is directly tied to blood flow and protein levels. When the liver is under stress, whether from cirrhosis, fatty liver disease, or hepatic dysfunction, it produces less albumin, the main protein that keeps fluid in your bloodstream where it belongs. When albumin drops, fluid leaks into surrounding tissue. In the nail bed, this fluid accumulation causes the tiny blood vessels that give nails their pink color to compress and recede toward the tip. The result is that ghostly white appearance across most of the nail. A foundational study published in 1954 by Dr. Richard Terry at Boston University first described this phenomenon, and the research has held up for over 70 years. More recently, a 2020 study from the University of California, San Francisco, published in the Journal of the American Academy of Dermatology, found that Terry's nails were present in approximately 80% of patients with confirmed cirrhosis of the liver, and in 25% of patients with chronic heart failure, many of whom had received no formal heart diagnosis at the time of their nail exam. A 2018 analysis from the Mayo Clinic, published in the Archives of Internal Medicine, found that among patients over 65 presenting with Terry's nails and no prior diagnosis, 43% were subsequently found to have significant hepatic or cardiac pathology within 12 months. 43%. That is not a rare coincidence. That is a clinical signal. Consider the story of Robert, a 71-year-old retired engineer from Florida. Robert came to his cardiologist for a routine annual visit, feeling fine. He had no chest pain, no swelling in his ankles that he'd noticed, no unusual fatigue. But during the exam, his cardiologist glanced at his hands and immediately ordered an echocardiogram, an ultrasound of the heart, because Robert's nails were almost entirely white. The echo revealed a left ventricular ejection fraction of 38%, meaning his heart was pumping at just over half its expected efficiency. Robert was diagnosed with early-stage congestive heart failure and started on a treatment plan that, according to his cardiologist, added meaningful years to his functional life. He had no idea. He felt fine. What can you do right now? In good lighting, hold your nails flat and look at the color distribution. If the pink is retreating dramatically toward the tip, that warrants a conversation with your doctor, specifically about liver enzymes and a cardiac workup. And here's an important zero-cost habit. Reduce your alcohol intake immediately. Even moderate regular alcohol consumption accelerates hepatic stress in adults over 60, because the liver's enzymatic processing capacity declines by roughly 30% between ages 40 and 70, according to research from the National Institute on Aging, published in 2016. Your synergy note here is powerful. If you are also showing spoon-shaped nails from iron deficiency alongside Terry's nails, you now have two simultaneous signals pointing toward a cardiovascular system under significant stress. When those two appear together, the urgency to seek medical evaluation doubles. And now I need to tell you about number 2, a nail change that is directly connected to a neurological condition that over 50 million Americans are living with silently right now. This one involves the nervous system, and what I'm about to explain will fundamentally change how you think about the shape of your nails. Number 2, and this is where my own specialty, neurology, comes directly into focus. Run your fingertip across the surface of your nail, from the base toward the tip. Now do it again, pressing gently. Do you feel a horizontal groove? A ridge that runs across the width of the nail, like a faint line pressed into it. If you do, you may be looking at what physicians call Beau's lines. And after 60, these lines are among the most significant nail-based indicators of systemic illness, including uncontrolled diabetes, severe infection, or a condition called peripheral neuropathy, where the nerves in your hands and feet begin to lose their signaling function. Here is the biological explanation, in plain terms. Your nails grow continuously from a structure at the base called the nail matrix. Think of it as the factory that produces your nail. Under normal circumstances, this factory runs at a steady, uninterrupted pace. But when your body experiences a significant systemic stress, a serious illness, a major metabolic disruption, extreme nutritional deficiency, or a surge in blood glucose, the nail matrix temporarily slows or stops production. When growth resumes, it resumes at the point where it stopped. The result is a visible horizontal groove across the nail that records that disruption, like a growth ring in a tree. You are literally reading your body's crisis history in the surface of your nail. In people over 60 with uncontrolled or undiagnosed type 2 diabetes, this mechanism becomes chronically activated. Persistently elevated blood glucose disrupts the microvasculature, the tiny blood vessels, that feed the nail matrix, creating recurring episodes of reduced nail growth. A 2019 study from the University of Toronto, published in Diabetes Care, found that Beau's lines were present in 54% of patients with poorly controlled type 2 diabetes, compared to just 9% of age-matched controls without diabetes. That's a 6-fold difference in prevalence. Additionally, a 2022 research review from Oxford University, published in the Journal of Neurology, established that peripheral neuropathy, which affects the sensory and motor nerves in the extremities, was identified in 38% of patients who presented with recurring Beau's lines and no prior neurological diagnosis. This is personal to me as a neurologist because peripheral neuropathy is one of the most commonly misdiagnoses in adults over 60. People feel tingling in their fingers, numbness in their feet, a strange burning sensation at night, and they assume it's just age. It isn't. It is a measurable, diagnosable, and in many cases, treatable neurological process. And your nails may be showing you the warning before your symptoms become severe. Helen was 63 years old, a retired accountant living in Georgia, when she came to her primary care physician with what she described as weird ridges on her nails that had appeared over the past year. She had also noticed mild tingling in her feet, but had dismissed it. Her physician recognized Beau's lines and ordered a fasting glucose test and an HbA1c, a measure of average blood sugar over 3 months. Her HbA1c came back at 8.4%, well into the range of uncontrolled type 2 diabetes. A subsequent nerve conduction study confirmed early-stage peripheral neuropathy. Helen was referred to an endocrinologist, started on a structured dietary and medication plan, and within 18 months, her HbA1c had dropped to 6.7%, near the boundary of normal, and her nerve conduction scores had improved by 22%. Her nails, she later noted with some emotion, had smoothed out almost entirely. What can you do immediately? First, look and feel. Run your fingertip across each nail. Multiple horizontal grooves across several nails simultaneously, not just one nail, is the clinically significant pattern. A single groove on one nail may simply be from an injury. Grooves across multiple nails point to a systemic event. Second, if you notice this, request an HbA1c test from your doctor, not just a fasting glucose, because the HbA1c gives a 3-month average and is far more revealing. Third, begin a simple daily walking habit. A 2020 study from Stanford University found that 30 minutes of brisk walking, 5 days a week, reduced insulin resistance in adults over 60 by up to 35% within 12 weeks. 35% from walking. The synergy point is critical. Beau's lines, combined with the spoon shape from number 4, paint a specific picture of a body managing both metabolic disruption and nutritional deficiency simultaneously. A combination that accelerates nerve damage significantly. Address both, and you address the compounding effect. And now, number 1. I have been building toward this deliberately, because the nail change I'm about to describe is the one that my colleagues and I find most alarming in older patients. The one most frequently dismissed, and the one most directly connected to a disease that kills more people over 65 than almost any other. Do not go anywhere. Number 1, and I want you to really pay attention here. Hold one hand up in front of you. Now bring the nail of your index finger and the nail of the same finger on the opposite hand together, back to back, so the nails are touching. Look at the gap between the two nails near their bases. There should be a small diamond-shaped gap, a tiny window of light visible between the two nails. If that gap is gone, if the two nail bases press flush against each other, that is what physicians call a positive Shamroth sign, and it is the most reliable clinical test for nail clubbing. And nail clubbing in adults over 60 is one of the most well-established early warning signs of lung cancer, chronic obstructive pulmonary disease, COPD, or serious cardiovascular malformation. The physiological mechanism is one of the most fascinating and alarming in all of medicine. When your lungs are compromised, whether by a tumor, by chronic obstructive disease, by pulmonary fibrosis, or by other pathology, your blood oxygen saturation begins to fall. Your body responds by releasing signaling compounds, including one called vascular endothelial growth factor, or VEGF. This compound triggers the growth of new blood vessels in the tissue beneath the nail bed, in an attempt to compensate for the oxygen shortage. Over time, this vascular proliferation causes the soft tissue beneath and around the nail to thicken. The nail curves downward over the swollen fingertip. The angle between the nail and the skin at the nail's base, normally less than 180 degrees, widens beyond that point. The clubbing is your body literally trying to build emergency oxygen infrastructure in your fingertips. The research on this is both old and consistent. A landmark 1976 study from the Royal Brompton Hospital in London first formally quantified the relationship between nail clubbing and pulmonary malignancy. More recently, a 2018 study from Memorial Sloan Kettering Cancer Center, published in the journal Chest, found that nail clubbing was present in approximately 35% of patients with confirmed non-small cell lung cancer at the time of their initial diagnosis, meaning it appeared before many other symptoms. And crucially, a 2021 study from the University of Michigan, published in the Annals of Internal Medicine, found that among adults over 65 presenting with clubbing and no prior pulmonary diagnosis, 29% were found to have significant lung pathology within 6 months of follow-up imaging. 29%, nearly 1 in 3. After age 60, this signal demands even greater attention. Lung function naturally declines with age. Forced vital capacity, which measures how much air your lungs can expel, decreases by approximately 1% per year after age 25. By 65, many adults have already lost 20 to 30% of their maximum lung function. When disease compounds that natural decline, the threshold for serious consequences is reached much faster. The VEGF response, the nail clubbing signal, activates earlier and progresses more rapidly in older adults, precisely because there is less physiological reserve to compensate. James was 69 years old, a former smoker who had quit 15 years earlier. He felt well, exercised regularly, and had no cough and no shortness of breath. He came to his physician for a routine physical. During the exam, his doctor performed the Shamroth test, pressing James's nails together, and found no gap. James also had a subtle downward curve to his nails that he had never noticed. A low-dose CT scan of the chest performed within the week, revealed a 1.4 centimeter nodule in the right upper lobe of the lung. Biopsy confirmed early-stage non-small cell lung cancer, stage 1. James underwent a minimally invasive surgical resection. His 5-year survival probability at that stage exceeded 80%. His oncologist told him directly, if they had waited for symptoms, the story would have been very different. What can you do right now? Perform the Shamroth test on yourself. It costs nothing, takes 10 seconds, and could be the most important 10 seconds of your year. If the diamond gap is absent or barely visible, or if your nail curves noticeably downward over the fingertip, bring this to your physician immediately and ask for a chest X-ray or low-dose CT scan. If you are over 50 and have ever smoked, even if you quit decades ago, you may already qualify for annual low-dose CT lung cancer screening under current U.S. Preventive Services Task Force guidelines. Ask your doctor explicitly, and avoid secondhand smoke, air pollutants, and radon exposure in the home. Radon testing kits are available for under $20 and are worth every cent. The synergy between all 4 signals is profound. Clubbing, combined with Terry's nails, suggests a cardiovascular and pulmonary system both under stress. Clubbing alongside Beau's lines may indicate a systemic illness severe enough to simultaneously affect oxygenation and metabolic regulation. Seeing any 2 of these 4 signs together is not a coincidence. It is your body speaking to you as clearly as it knows how. Listen. Today you learned 4 nail warning signs that your body may be using to tell you something critically important. Spoon-shaped nails, koilonychia, are an early warning of iron-deficiency anemia, a condition affecting 1 in 5 adults over 65 that steals your energy, your clarity, and your cardiac resilience. Terry's nails, where most of the nail turns white, signal the liver and heart under stress, and were present in 43% of patients later found to have serious hepatic or cardiac disease. Beau's lines, those horizontal grooves you can feel across your nails, record systemic crises and are present in over half of patients with poorly controlled diabetes, often alongside early peripheral neuropathy. And nail clubbing, detectable in 10 seconds with the Shamroth test, is one of the most reliable early signals of lung pathology, including lung cancer, appearing before symptoms in a significant percentage of cases. Here is what I most want you to take away. Your body is not working against you. It is communicating with you. And the most powerful thing I know after 27 years of neurology is this: prevention and early detection are always, always more powerful than treatment after the fact. It does not matter if you are 61 or 81. What matters is what you do with what you now know. So I want to ask you one final question, and I genuinely want your answer in the comments. Which of these 4 nail signs are you going to check first? And what has been your biggest obstacle to paying attention to your body's early warning signals? Tell me. This community learns from each other as much as from me. If this video gave you something valuable, please give it a like. It takes 1 second, and it helps this information reach someone who may genuinely need it. Subscribe if you haven't already. Share this with someone you love who is over 60, and leave a comment. I read them. Your health is not behind you, it is ahead of you. And it starts with what you notice today.